The nice thing about this is that when the patient has indeed true supraspinatus tendon problem, it'll be tender on palpation. So they will almost tell you where it is. And in this video here, what I'm trying to show is that you can put a needle on either side of that tendon. And I'm showing you that by pushing very hard with my middle finger and inserting at the same time, patients feel the finger more than the needle itself. So it makes this technique a lot more comfortable and tolerable and pleasant for the patient. I want to mention that the lines here were supposed to mark the location of the supraspinatus tendon. Was done when the patient was sitting up, so the location has changed. So it is not meant to demonstrate where the needle in relation to the tendon. Okay. Now the last muscle we have to talk about for the rotator cuff is obviously the subscapularis muscle. And so the point heart one in the axilla can be thought of in two ways. It can be thought of as the subscapularis muscle or its nerve, the subscapular nerve, or if you go right in the center where the pulsation is, and the classic certainly alludes to there being a pulsation. So in other words, it's the neurovascular bundle. It's actually the brachial plexus that describing. Then you would be talking about targeting the brachial plexus. That's not the focus of this particular topic. Obviously, we'll focus on the subscapularis more, but I'm just including this in this in completeness sake. If you want to learn more about addressing other aspects of the upper extremity, 14-hour courses on healthyseminar.com that you can, I'm sure, spend weeks, if not months, trying to absorb this information. But for the purpose of this workshop, I'm going to call heart one not brachial plexus, but specifically the subscapular nerve. Now let's take a look at the anatomy of this. It is possible to separate the scapula from the rib cage enough to expose its interior surface so that we can target the subscapularis muscle that lies here. Obviously, you need to be between the pec major and the latissimus dorsi. If you weren't on the bone, you were too lateral, chances are you're going to put the needle in the latissimus dorsi. So this is why I emphasize that there's an absolute need to confirm this using a device like a pointer plus device, because otherwise you might think you're in the subscapularis, but 95% of the time, if you didn't test it, you're actually in the latissimus dorsi, which does attach to the scapula, which does help the scapula, but it's not going to do a darn thing to improving internal rotation with the subscapularis.